Hello, everyone. Myself, Dr. Achal Sharma. I am a neurosurgeon working as a senior professor in the Department of the Neurosurgery, SMS Medical College, Jaipur, which is a tertiary level hospital, and it's the biggest hospital in the Rajasthan state. And it's covering many patients who have come from the not only from Rajasthan but nearby states like UP, MP, Haryana, as well as Punjab. So today's topic is brain tumor and the spinal cord tumor. As we know that brain tumor and spinal cord tumor both carrying a very dangerous to hear about whenever a patient hears that he's suffering from the brain tumor or spinal cord tumor, spinal part of tumor is suffering. So there is a lot of difficulty him to realize that he is suffering with such a dangerous disease, which carries not only morbidity but also the mortality. It carries also the burden to the family and the person who are attached to them, and always think about what would happen to him or her and his siblings. But it's not the true fact about these tumors. Brain tumor all not always a cancerous or a malignant tumor, but they are also benign tumor, or rather, I would say the tumor which are not cancerous, which are present in a particular site of the brain or skull, and which can be removed very easily, and then patient becomes cured from that disease. Likewise, also in the spine, tumors both are malignant as well as benign, means they are not cancerous, they remain on their site of origin. These tumors do not spread to other parts of the body via the blood or direct or spread or something else. So both types of the tumor we see in the brain as well as in the spine. So what are the tumor? Tumor is an abnormal growth of the cells in any part of the body. So likewise in the brain and spinal cord, whenever these abnormal growth of the cells occurs, there is a mass which gradually or sometimes very fast growth inside, and these size increase causes pressure to the normal brain and the site from where these tumor originates gives the symptom to the patient. Suppose a tumor which arises from the part where the visual pathways are there. So patients suffer from the loss of vision. If the tumor originates from the hearing nerve, which we call the vestibular cochlear nerve, then patients suffer from the vertigo, then hissing or machinery type of the sound in his ear, which is known as tinnitus, and also the disequilibrium to the patient in which he feels dizziness, vertigo, unsteadiness in the gait. Suppose if the tumor is in the part of the brain which control to one half of his body, right or the left, patients have the symptom of that part of the body. Also in the spine, if the tumor originates from the outer side to inner side, so the part which gradually become compressed by the tumor gives the signal to the patient as well as to the doctor. So we, by hearing the history part of the patients, we can diagnose that patient might suffering from a mass lesion, which is tumor, which is present of certain part of the spine and giving the symptom to the patient. And By listening of his complaint or problem, we can examine thoroughly or neurologically to confirm that yes, the patient is suffering this particular site of the brain as or the spinal cord, and then we carries out the investigation. Nowadays, very advanced investigation facilities are available in which I know that most of the person know about the MRI, CT scan, PET scan, angiography. So by all these investigations, we can exactly pinpoint the tumor, its location in the brain or the spine, its size, as well as in most of the time, we can even assess the nature of the tumor, whether it is a cancerous or malignant type of the tumor, whether it has come from the other part of the body into the brain or spinal cord, or whether it is in the brain itself or the tumor originate from the brain cells. So the diagnosis is very important for the management part. So there are very advanced managements nowadays in which in last few decades there's a lot of advancement has occurred in the neurosurgical field in which we can take out more and more tumor and sometimes the total tumor out from the brain and spinal cord and can give patient to a healthy life in the future. The tumor is removed in part, not totally. Then by knowing the cell of origin, there are further treatment in which we know that the role of the radiation therapy is very important, as well as there are chemotherapy available. The advancement also occurred in the field of the radiation, where nowadays radiosurgery, in which gamma knife, LINAC therapy, or the cyber knife are available with us. By this modality, we can deliver a high dose of the radiation to the part which are suffering from the tumor without harming the adjacent part of the brain or spinal cord. So this type of the radiation therapy hits more to the tumor while the part which are adjacent to the tumor, the function of that remains unaffected. Likewise, many chemotherapeutic agents are now present, and by these chemotherapeutic agents, we can control the growth of the tumor as well. WHO or World Health Organization classified the brain tumor in various ways, and particularly the site of origin or the origin of the tumor, we can give whether it's in the cells of origin is the brain itself, in which intrinsic tumor like the astrocytomas are there, or the tumor originates from the embryonal part in which medulloblastoma more common. Sometimes the tumor originates from the covering of the brain in which the meninges are there and the tumor is known as the meningiomas. Sometimes tumor which I told you that reach to the brain or the spinal cord from other part of the body, that is known as metastatic tumor. So the management is different for all these tumors. But yes, now slowly and slowly we are reaching to the part where we can either cure the patient or give a longer life to him. So no need to afraid. Better you are careful. You should be very careful to your symptoms initial period, or beginning part, so that you can diagnose your disease early and your doctor can treat yourself more thoroughly, more aggressively, and you can live a longer life. So, what are the basic or common symptoms which are present when a patient suffers from brain tumor? I told you headache is the most common feature. Headache associated with the vomiting. There can be visual deterioration. There can be unsteadiness of the gait, delirium, or there is there can be a weakness of one part of body or loss of sensation from particular part of the body, in which patient may suffer from the paralysis or hemiplegia, means the weakness on one half of the body or even the weakness on the both half of the body. There could be loss of control to the urine and motion, behavioral changes, and like these, there are many other symptoms for particular tumor, but they are less common. The more common symptoms which I narrated previously. In spinal cord, usual symptoms are pain to the site of the origin of tumor, and sometimes when the tumors give the pressure to the nerve adjacent to the tumor, or sometimes even the tumor originates from the nerve. So there can be a radicular pain. Radicular pain means the pain originates from the one side in the spine or the suppose in the cervical region or lumbar region, means in the lower part of your back, and then pain goes along with nerve which are going from that particular segment of the spine, and patient may suffer from the pain going to the one half or one side of his lower limb or leg, or in the upper limb or the hands, and paresthesia, or I would say that the altered sensation or some abnormal type of sensation to the hands or the feet. Apart from these, spinal cord tumor also can give rise picture of paralysis of lower limbs as well as to the upper limb. Or in some cases, when the tumor is in a higher part of the spinal cord, patient may suffer from the weakness in all four limbs. Also, the patient may have loss of control to his bowel or bladder habits, means the urination as well as motion. So these are the common symptoms. We should be careful about the symptoms in the early period of the disease. So we can go to the doctor. We can investigate, can diagnose the tumor in the early part. So it can be treated early, so a good results can come out. Thank you very much.